Recruiting and retaining top talent in the healthcare industry is a major current challenge. Today we are learning what Genesis Health System is doing to recruit healthcare workers. And today we are joined by Megan Chadwick, DEI and Recruitment Director, and Nora Perkins, a patient care tech, in this segment sponsored by Genesis Health System. Thank you, ladies, for taking the time to talk to us today.
Thank you. We appreciate the invite.
So, Megan, let's start with you. What would you say are the biggest challenges in trying to recruit healthcare workers in 2023?
What we're having to do now is not only find qualified talent, but also really reinvigorate people into wanting to be in healthcare.
Right.
And so Genesis has done a really great job of trying to create new ways to grow our own. For example, we have an MA residency program where we can have people that start in the organization in maybe a clerical or non-medical position, and then they can get on-the-job training and secure an MA profession. We have scholarships, but you need people to train them to do that. And then in addition to that, I would say, which compounds from the shortage in talent, is just burnout. Again, you're asking the people that are doing the work to do those extra things while still providing the high quality care that's really important to us.
Yeah, it can be a little stressful.
It is,
right?
It is. And I'm, non-clinical, so I'm speaking on their behalf, but if I'm feeling it in my role, they're certainly feeling it too.
Definitely. So talk to us about WalkIn Wednesdays and how that concept came about.
So what we decided is that we wanted to do an on-site event, but let's do the same day each month to make sure that not only our external public knows, but our internal public, our customers, our leaders, they are aware of that as well. So that was where the last Wednesday of each month came into sequence. And then we wanted to, again, keep that convenience as well. And so we tried to do the 3 to 6 time frame would allow us to capture people that were experienced and maybe coming to or from work, but then also those non-experienced people that might want an opportunity and have that free time. And so it really allowed us to meet both worlds. And then really that walk-in concept, kind of that non-obligation, I think really attracted people, because being a mom myself, kids get sick. Or if you're coming from work, you might have to work late. So we also added an RSVP feature into it so that if you planned on coming, you could RSVP, but if you couldn't come, we still had your information so we could connect with you afterwards. So it really hit on all cylinders for us.
That's so convenient.
Yeah, and I think I've heard, and I'm sure hopefully Nora will speak to this, but it's worked really, really well.
Yeah, so are there certain job categories you're focused on during your WalkIn Wednesdays?
Now our summer session is clinical focused. Certainly that's nursing and nursing support, but that also is your allied health professionals like therapy or respiratory therapist or pharmacy. But at the end of the day, if someone comes in and they're seeking an opportunity, we're willing to meet with them. We'll have the conversation, and it's really just about finding the right fit.
Okay, so how does a typical WalkIn Wednesday work? This is kind of where they're located, right? Where we're sitting.
Yep. This is the lobby. This is the waiting room, so to speak. So we've done it so that's at the main entrance of our Silvis and our East Campus, because we wanted to make it, again, convenient and easy for people to recognize. They come in, and really what I've told people is come into it expecting that you're going to interview for a job you want to accept.
Okay.
So it is convenient, but we also want to ensure that you come prepared and you're professional, bringing in a resume. But really the first step is they're going to interview with one of our HR support personnel, which is the first step in the process. And then should that interview go well and both parties agree there's an opportunity to explore, then they will meet with a leader if they're on site. If that leader isn't on site, we may be able to reach them by phone. And then if as a last resort we can't do that, it's our obligation to then get them connected with that leader in 24 to 48 hours after, again, if there's an opportunity that really fits both needs.
I love that. I love that opportunity for so many folks. Nora, you actually got your job as a PCT through this WalkIn Wednesday event. So how easy was the process for you?
It was the most simple process I've gone through when it comes to a job. I have to say that. I had figured out about it through Facebook, actually. There was a lot of Facebook ads, and my mom sent me the text and was like, do this, Nora, because I'd been looking for jobs and I couldn't quite find exactly what I was looking for. So it was super easy. I signed up, and again, the slot was 3 to 6 with tons of flexibility, and I'm a student. So it was really nice just being able to come in whenever and talk with them for maybe 30 minutes for an interview, and then after that, just see where it goes. So it was really convenient.
So what would you say to someone who might be considering a job in healthcare and maybe considering coming to one of these WalkIn Wednesday hiring events?
My advice would just be to be confident. I know when I was walking in, I was super nervous. I was like, oh my gosh, I've never worked in healthcare before, so it was something brand new to me. And so I say, just be confident. I was chatting with other people, and they're like, oh my gosh, I'm so nervous. I'm like, after I done my interview, I'm like, you got it, girl. It's really not that bad. So just be confident.
Yeah, and an easy process,
yes,
you say.
Easy process. Yeah.
And having Nora's energy obviously adds to that as well.
Yeah.
I think the excitement she has helps us get excited about it also.
Yeah, and I was going to ask you, how successful have these Walk-In Wednesdays been? I mean, you got an employee like Nora. So.
I know. They honestly have been, I think, fair to say, with my team in the beginning, surprisingly well, and we've continued the momentum. So we've had almost 300 attended so far since February, and we've secured at least 78 accepted offers, and majority of them have already started.
Awesome. Okay, when is your next session, and where can people, check for maybe future sessions?
Yeah, absolutely. So we are going to be here at East Campus and then at our Silvis campus on the Illinois side, right off the main entrance for both on Wednesday, August 30th is the next event. All of this information is posted on our social careers page, so if people are interested, they can find that information there. But the easiest way to remember it is it's the last Wednesday of each month, 3 to 6 p.m.
All right, as easy as that.
As easy as that.
All right, well, Megan, Nora, thank you so much for taking the time to talk to us today.
Yes, thank you.
Again, this segment was sponsored by Genesis Health System. For more information, go to genesishealth.com/WIW. We'll also have all those details posted on ourquadcities.com. More Living Local continues after the break. Stay with us.